Hey parents, how often do you get to talk to a doctor free of charge to answer your questions? That is what's happening right now. We are answering your questions about COVID-19 and kids with Cone Health Executive Medical Director of Pediatric Services, Dr. Michael Cinnamon. Over the break, someone texted in a really interesting question about the heart issues we were talking about earlier. She said, if my daughter caught COVID and the heart problem she had prior to that worsened, would you suggest attempting the COVID shot?
We generally do recommend that people who have COVID get vaccinated. That's a very common question. The immunity that you seem to get, the protection that you get from the vaccine is actually more potent than from getting the infection itself. There are many reports of people getting infected and then getting reinfected with another variant. The vaccine seems to protect people from all of the variants that we have right now, and the protection is very good. However, in this particular question, if I understood correctly, the parent's daughter actually had some sort of pre-existing heart condition and perhaps got COVID. That's a situation I think you definitely want to talk to your pediatrician or your cardiologist to determine what is best in that particular case.
And that seems to really be the bottom line here, is if you have questions, there are people to reach out to about the vaccine, right? You want to talk with your doctors.
I couldn't agree more. I mean, they are still, I believe, the best source of information about COVID. We've all, myself and my colleagues, have learned an awful lot in the past year and learned a lot about the vaccine and learned a lot about the disease. I think people will still need to make their own choices, but I think the physicians and nurse practitioners and all the people that take care of our patients have become very educated about this and can answer most people's questions. And I think, again, the news is good, and the vaccine that we have is excellent.
The doctors definitely know a lot more than the people on Facebook, for sure. And here's a good example of answering a question about that. Someone wanted to know a specific. Have there been any deaths from the heart inflammation caused by the vaccine, especially in those 12 to 24?
Again, great question. And the answer, as far as I know, up to today, the answer is no. The heart inflammation has been very mild and self-resolving. I've seen cases of viral myocarditis or heart inflammation caused by infections over the years, and they can be very serious and really cause a lot of clinical problems. This, as related to this vaccine, appears to be, as it goes, relatively mild and self-resolving. So again, as we do with anything that we do in life, and certainly in terms of our choice to vaccinate someone, we're always weighing the risks and the benefits of it. And I think the medical community is pretty clear that the risk of getting COVID or any of its numerous complications appears to far outweigh any risk that would be associated with getting this particular vaccine.
So speaking of side effects, a lot of my friends, family, they got the shot. The second one particularly, they felt a little down. It was a little rough for some of them. Is that the same way for kids? Are they experiencing it the same way?
Generally, yes. And that can happen. I think what you just related is not an uncommon scenario. I happen to have a very good experience with both of my vaccines. My wife had a much tougher time the second time around, really felt bad for a day. But usually it's those symptoms are very self-resolved. People can feel flu-like, fatigued, tired, really wiped out for a 24 to 36 hour period after the vaccine. And the same is true generally for teenagers. The side effect profile is almost exactly the same.
And it's still a whole lot better than getting coronavirus, for sure.
A whole lot better.
Well, hey, we have a lot more questions coming in about if this vaccine works so well, why are people who are vaccinated still getting the virus? We're going to talk about that and so much more. Keep texting your questions, 336-379-5775. We'll be right back.